Hello everyone, today we will discuss another new topic which is a common query by patients. How is squint surgery performed? How difficult it is, whether we are affecting vision is being compromised. To understand that, we'll need to understand the structure of the eye and how are the muscles placed and how we perform the surgery. By that we'll understand that nowhere during the surgical procedure we are entering inside the eye, so vision is not going to be compromised at all. To see the structure of the eye, so this is the outer part of the eye which we call the cornea, and then we have the iris which gives the color to the eye. Normally we see brown color eyes, and beyond that we have this lens, and these are the eyelids, and this is the eye which goes beyond, and this is the optic nerve which relays the vision whichever we see to the brain, and this is the retina part of the eye. And these are the muscles which serve the purpose of the movement of the eye, and these are placed outside the main structure of the eye. If we understand this from this model as well, this is the outer part of the eye which we are able to see. This is the cornea, this is the iris, and lens is placed behind, and this is the eyeball, and these are the muscles which are placed on the surface of the eye. So these are outside the eye, and we operate on these muscles, and in no point of time we are entering inside the eye. So vision, there is no question of vision being affected during the surgical procedure of squint. If we cut a cross section of this, so this is the eyeball and these are the muscles. There are 4 recti which are responsible for the movement of the eye, apart from 2 obliques being there. They move the eye. Each of the muscle has different purpose. One is responsible for the inward movement, outward movement, upward or downward movement, and we tackle these muscles during the squint procedure to cure the squint. So if we have to correct inward deviation of the eye, so we will be loosening a certain muscle or strengthening a certain muscle in order to correct the squint. So if we are weakening a muscle, so we'll place this muscle slightly behind from whatever was its original position, and that would lead to weakening of the procedure. In order to strengthen a muscle, we can cut a part of the muscle to correct the squint, and all this procedure is done outside the main structure of the eye, so vision is not going to be compromised at all. So this is one of the major queries of the patient, that can the vision be compromised after the squint surgery. So this question has been very well answered, that nowhere the vision is going to be compromised. Hopefully this information would be useful for you, and you will pass on this information to your colleagues and friends so that they can also make use of this information. Thank you.